All right, so I will be kicking off the case competition today. For those of you who don't know me, my name is Charlotte Glasser. I'm a second year in the MBA program involved with the MBA Healthcare Club. So huge thank you to the Center for the Business of Health for putting on this awesome day. Excited to introduce the next portion of today, which will be the case competition. So for those who are unfamiliar, we have some interdisciplinary student teams who were tasked with solving behavioral and opioid use disorder problems in North Carolina. So thank you to all the teams who competed. We're really excited about the turnout, and we're excited for everyone to see their solutions. So if you can give me a hand in welcoming our first team. Thanks.
All right. Good afternoon, everybody. So my name is Avani Desai. I'm joined here by Grace Tabor, Alistair Scully, and Lisa Regula, and we are a team of medical and MPH students. And we're really excited to have this opportunity to provide Acadia Healthcare with our recommendation on how to expand access to behavioral healthcare in North Carolina. So the premise of the case is that Acadia Healthcare is looking to meet its revenue goal in North Carolina and expand its behavioral health services in a manner that is equitable and community focused. So first, we'll just give an overview of our recommendation, and then we'll obviously give more details about all of these factors later. So given this situation, we've identified Robeson and surrounding counties as an area within North Carolina to target, and we recommend that Acadia approach this area through a partnership with UNC Health Southeastern. To maximize the efficacy, equity, and profitability of this partnership, we recommend taking a systems level approach, which we will detail. Additionally, Acadia will have the really exciting opportunity to innovate to improve outcomes, especially with regards to technology and recruitment. So we'll talk about those later. And ultimately, we project that this initiative will earn Acadia a revenue of $114 million over the next 5 years.
All right. So now to just provide some context and background about the current healthcare landscape in North Carolina. Overall, there is increasing need for behavioral health services just in general. But most shockingly, the rate of opioid overuse deaths is drastically increasing. This rate is outpacing the national average. And unfortunately, these kind of negative trends are met with some challenges like a shortage of behavioral health providers. It takes a long time to become established as a new patient with these providers. And then there's also a high cost to patients. A positive trend, though, is that a large proportion of telehealth visits in North Carolina are addressing behavioral health concerns. So this could provide a potential solution in the future. And we will now go into some specific strategy recommendations for Acadia Healthcare. So to first determine the area of North Carolina that we wanted to target, we looked at the existing locations of Acadia's comprehensive treatment centers, and then also looked at counties with the highest need for behavioral health services. We used 2 markers for this. We used opioid overdose deaths, there we go, along with ED visits for suicidal ideation. And you can see Robeson County is marked with the purple star. This county has some of the highest rates of opioid overdose deaths, along with ED visits for SI. And there is an Acadia CTC in the neighboring county, Cumberland County, but this is a large geographic area, and the patient population that we're targeting doesn't typically have good access to transportation to be able to travel long distances to seek services. So for this reason, we have chosen to target Robeson County. In doing so, we are also improving equity in the healthcare system. A large proportion of the population in Robeson County is low income. A large percentage live in poverty. They have a very unique racial and ethnic background. A large proportion come from American Indian and African American backgrounds. And from a healthcare perspective, we know these populations tend to receive worse care and thus have some worse health outcomes. This population is so unique because of the Lumbee tribe. They make up the majority of the population as like a single group. They are not recognized federally though, so they don't receive the benefits from the Indian Health Service. As mentioned before, Robeson County does have some of the worst health outcomes in North Carolina in general, and with behavioral health issues. This is made worse with a shortage of psychiatrists specifically, with none specializing in addiction medicine. So there is a large need in Robeson County for Acadia services, just given these demographics previously mentioned, along with the poor health outcomes.
So of the three options offered to us in the case, to buy, to acquire, or to partner, we believe that entering a partnership is most aligned with Acadia's project and their company goals. We'd specifically recommend partnering with UNC Health Southeastern, as Ebony mentioned, a well-established comprehensive healthcare system based in Robeson County. They already have a significant inpatient bed count, as you can see, with additional outpatient primary care and specialty clinics. They employ 135 physicians, notably though, only about 3 of their physicians are psychiatrists, demonstrating a gap in their care. But they already have a market draw of more than 175,000 patients, making it an already strong beacon in the Robeson County community. But backing up beyond just the specifics of Robeson County, we strongly believe that partnering will be the most effective and lucrative strategy for Acadia Health based on their prior joint venture success, the role of partnership within their current growth strategy, and the ability to ease recruitment struggles that Acadia has been facing nationwide. First and foremost, Acadia is clearly good at being a partner. Partnerships have been one of their main growth focuses, and they found massive success here, expanding their geographic footprint with 8 established JVs and a combined 760 beds just since 2015. Acadia has formed strong relationships with premier health systems across the country, like Geisinger, Henry Ford, Tufts, and most recently ECU, another public system in North Carolina, where they partnered to increase ECU's inpatient psychiatric capacity. Additionally, Acadia has excelled in multiple styles of partnership over the years. Some of these include joint ventures, psychiatric ED management, mobile assessments, telehealth, and population health. So having a diverse array of collaborative experience enables Acadia to develop flexible and innovative partnership structures in the future. And as I mentioned, Acadia has clearly focused on leveraging these partnerships to expand their services. Of their 3 growth pathways seen here, you can see that partnerships are projected to increase the most over the next few years, with more than 20 JVs currently in the pipeline, 4 expected to open in 2024 and another 4 opening in 2025. The addition of a UNC Health Southeastern partnership would align with Acadia's current strategy and continue this JV acceleration that we believe is the future of Acadia's growth. And it's no secret, recruitment of talented behavioral health staff is going to be challenging no matter which growth option you move forward with. There are simply not enough providers to go around. North Carolina's mental health care workforce, for example, only meets 13% of the need of our state, much lower than the national average of about 28%. However, the benefit of partnering with an established system over building or acquiring existing facilities is that Acadia would start here with a leg up, the ability to leverage some of UNC Health Southeastern's current staff to really get this partnership off the ground. UNC Health Southeastern currently has 11 health professional educational partners as well, including Duke, UNC, Wake Forest, and other nearby universities and community colleges. These previously established relationships make it really easy for Acadia to invest in pipeline programs to build the workforce of the future here. UNC Health's brand recognition will be helpful in recruiting local talent, and our joint investment in telehealth and AI will help scale workforce efficiency to decrease the recruitment need altogether. The root of all this is that we want to take a strength-forward approach, leaning on UNC Health Southeastern's HR infrastructure while letting Acadia focus on the clinical design and execution of the behavioral health partnership instead of being hamstrung by regional recruitment challenges or turning to travel. Ebony will also touch more on this recruitment topic later.
So now I want to take a moment to dive a little bit into our proposed actual architecture of this partnership, because we feel this is what really makes the idea of partnering special. So for anyone who has spent time trying to seek behavioral health care, you might have realized that you're often getting that care not necessarily with behavioral health care specialists, but with physicians across the clinical spectrum. So actually the majority right now, 80% of, I believe it's about 80%. But the majority of behavioral healthcare intervention actually does occur with the primary care physician. So with this in mind, we're actually going to attempt to leverage the interconnectedness and of the UNC Southeastern Health System for this partnership in order to try and address behavioral health at every clinical interaction. And I know that this might seem daunting and large, but it's actually the basis of the CDC's tobacco abuse framework for health systems change. So we're using that as a model for our program design. So the goal here is to systematically address and treat behavioral health, including things like opioid use disorder, at every clinical encounter. So this begins when the patient first encounters the healthcare facility and enters into care. This could either be through emergency transportation services or even just how they are triaged into the proper care pipeline within the hospital system. Then once they are actually within the system, we're going to try and target them at every single encounter. Acadia's specialty in behavioral health means that they can help other providers who may not be as well equipped to deliver high quality behavioral care learn the basics and also try and excel so that patients aren't falling through the cracks. We know that it is difficult for a patient to admit that they might need some help with their mental health or behavioral health. But if you're seeing a provider that you already trust in a different specialty, you might be more willing to engage with that kind of messaging. And then finally, we're going to try and bring this out into the community as well. So having a continuation after you actually leave the hospital system. And again, this is a benefit of having the partnership. So we can leverage existing community relationships with UNC Health Southeastern in order to help that continuum of care so that even when a patient isn't within our hospital, they're still receiving behavioral health care. Some examples of different innovative ways in which we plan to target patients for behavioral health care include through emergency medical services. So currently there's a major issue of overcrowding in emergency departments due to unnecessary hospitalization of patients with behavioral health care needs. So we would like to assist emergency EMTs with how to properly triage and then make a decision tree path about where those patients should go for care within the healthcare system. Additionally, we want to invest in intensive outpatient care. Outpatient care is on the rise, and we know that that is a great opportunity to intervene without having to actually be an inpatient in a facility. And this is also in alignment with site of care shift trends, which are currently going on throughout the country. Additionally, we would like to send out some more mobile clinics. So one of the few advantages of this COVID pandemic is that we learned how to deliver care in the community, and people now know where they can go to seek this care. And so we want to jump on that and try and continue to deliver care, but instead make it behavioral health care. So we can do this by adapting existing COVID mobile sites in order to help with the delivery of behavioral health care, bring it to the individual versus requiring them to come into the healthcare facility. And finally, and Avani, we'll touch on this right now in a little bit more depth, but we really do believe that bringing Acadia into the modern time with an increase in technology integration into behavioral healthcare delivery will really help patients be able to connect their providers and their care across like we mentioned, every encounter that they have with the health system.
Right. So through this partnership, Acadia gains a foothold in this region and gains this really exciting opportunity to innovate, to expand and improve behavioral health care. So starting with tech innovation, we really recommend that this partnership prioritize telehealth. So there's many benefits, included those listed here, but at its core, telehealth will allow increased access for patients to appointments, especially for those who may not be able to attend in-person visits. So whether that's because of financial barriers, lack of transportation, like we said, the population in this region is very spread out, because of stigma, embarrassment, whatever the reason is, Acadia will be able to work around these barriers to deliver more care and serve a larger patient base, get more patients in the Acadia network by implementing greater telehealth. We also recommend that Acadia leverage the partner institution system to sort of take on an electronic health record. Currently, Acadia lacks an integrated EHR. And as Lisa just discussed, tackling behavioral health and opioid use disorder involves addressing the overall well-being of a person. We can't just come at people from one silo. It's best to integrate this whole system. So through an EHR, we can take advantage of interoperable data sharing. This will facilitate management across and communication between providers at all points in the healthcare system. Similarly, EHR has these really, really powerful data analytic capabilities. We can analyze patient data in real time and understand readmission rates, use predictive analytics to generate personalized treatment plans, identify at-risk populations, and more, and thus improve patient outcomes and reduce the overall cost of care. And finally, a more minor point, but still something that we find interesting and worth looking into is remote patient monitoring. So this can manifest in many ways in the situation, whether that's medication adherence support or tracking patients' progress and vital signs outside of clinical settings. We also think that recruitment is a really exciting opportunity for Acadia. So through our own experiences in the clinical setting, we ourselves have seen, staffing shortages are a really real issue. And through this partnership, Acadia can employ some innovative strategies to sustainably tackle this issue. So there's many listed here, but there's two key points we want to highlight. So first is just working with the community. UNC Health Southeastern, like Grace said, has established relationships with 11 educational institutions in the state. We can use this to have students from various disciplines, medical, social work, nursing, across this whole spectrum, rotate through this partnership, serving as providers and staff, and even start earlier, implement internships and programs for high school students, community college students, even just community members to just provide a consistent supply of behavioral health workers and also just get people interested in this as a career path. The second key point we want to highlight is promoting remote work opportunities. So by promoting telehealth, you reduce the burden of reduce the requirement for in-person work. So we can add psychiatrists, providers, staff from across the state to provide care in the region virtually, thereby increasing the number of patients that Acadia can serve. So overall, there's some really promising opportunities for innovation to help Acadia achieve its goals.
But as solid as this strategy may feel, it doesn't exist in a vacuum. So it's really important that we touch on some of the policy and financial considerations that are going to play into the structure of this partnership. So starting with some national trends, it's clear that value-based care, rising costs, and price transparency are battles that nearly every health system will face, if not confronting it already. However, we believe that through this proposed partnership, Acadia is better preparing itself to handle these challenges. So in terms of value-based care, expansion across the care continuum improves Acadia and UNC's abilities to manage start to finish whole patient care and improve population health at scale. Providing preventative behavioral health care by leveraging UNC's primary care providers, like Lisa was mentioning, will help cut unnecessary ED visits or inpatient psychiatric stays to lower costs overall. Additionally, investing in innovative treatments like medication-assisted treatment for opioid use disorder can provide huge lifetime savings for patients while expanding our own scope of service. Lastly, price transparency rules are on the table and deadlines for compliance continue to loom. Integrating into UNC's EMR and investing in technology like Avani was mentioning will be essential for tracking accurate pricing and publishing it for consumer use. Zooming in on North Carolina, more specifically here, after years of debate, we will become the 41st state to adopt Medicaid expansion on December 1st, 2023, immediately granting new coverage to more than 621,000 people across the state. And we predict that this is going to have a massive impact on the healthcare demand, specifically in Robeson County. Right now, nearly 17% of Robeson residents are uninsured, and nearly 28% of them live under the federal poverty level. Given that this expansion is going to cover any adult making up to 138% of the federal poverty level, we can assume that a huge majority of those 17% uninsured folks will gain coverage immediately in December. With thousands of high-risk individuals gaining new access to behavioral health care, Acadia has the opportunity to fill this impending care vacuum and grow their market accordingly.
So finally, thinking about the finances of this situation, we project that this partnership will earn $114 million in these first 5 years. So starting with inputs, based on information we were given, Acadia has a 80% share in this partnership, and we project a 50% growth rate. So we acknowledge that this is very high, but taking a step back, we're establishing a very needed resource in a behavioral health desert at the same time that a significant portion of the population here is gaining access to these services. So we are not saying that this growth will be the standard, but this is in these first few years that we're starting up, we actually believe that this is quite feasible. So this growth projection is based on a continuation of Acadia's baseline growth, an expanded use of, or expanded number of Medicaid patients, and we have these calculations in the appendix for further reference, and the expanded use of medication-assisted treatment. So about 87% of people with opioid use disorder do not receive medication-assisted treatment. And so now we have all of these people from Robeson and neighboring counties who may be eligible now. So this 10% is more of a conservative goal that we've set in terms of increasing revenue. And finally, growth in telehealth. Similarly, this is a goal that we've set. Telehealth has enabled a significant increase in total behavioral health visits nationally. And some of this was pandemic driven, but we're seeing that this has continued even after the pandemic. So the data shows that telehealth use is significantly increasing. And so we've set this goal accordingly. Looking at the graph now, green represents the total revenue from the partnership and purple represents Acadia's stated 80% share. The first 2 years, there's no revenue due to the negotiation and development timeline. But if you add the projected revenue from years 3 to 5, we're estimating that Acadia will generate $114 million in this time frame. So in conclusion, this partnership presents a lucrative and impactful initiative for Acadia. Thank you for your time.
Yes.
We only get one more?
Hello. Hi, everyone. I guess to start, that was a great presentation from our fellow students. Great to see. We are also going to present. My name is Catherine Underwood. I'm an MBA candidate.
And I'm Mark McKee, also an MBA candidate.
My name's Molly Powell. I'm an MD candidate.
And I'm Janae Washington. I'm also an MD candidate.
So today we are going to share our business proposal for Acadia Healthcare. Our recommendation is that Acadia Healthcare partners with the UNC School of Medicine to expand on their existing single addiction mobile clinic and to incorporate syringe exchange programs on board. We believe that this will help Acadia achieve a total revenue of $120 million and, more importantly, reduce the opioid overdose death rates in North Carolina.
The opioid epidemic is a public health care crisis because opioid use disorder, or OUD, impacts several domains of life and has devastating downstream consequences. In 2021, there were over 70,601 opioid overdose deaths reported nationally, while over the last year, there has been a 22% increase in overdose deaths in North Carolina alone. OUD is characterized by the DSM-5, which is the Diagnostic Statistics Manual for Psychiatric Conditions, and is often comorbid with conditions such as depression, anxiety, attention deficit hyperactivity disorder, post-traumatic stress disorder, and bipolar disorder. And each one of these conditions impacts the mind, body, and family structure, making OUD a disorder of compound. This is especially true for historically marginalized communities, specifically American Indian and non-Hispanic Black communities, as their overdose rates have increased over the last years, while overdose rates within the majority population have decreased, and this is for any drug and any stimulant. For incarcerated persons, they are 40 times more likely to die from an overdose within the first 2 weeks post-incarceration. Non-Hispanic Black persons are 6.5 times more likely to be imprisoned for drug-related offenses. In 2021 alone, over 50% of the state prisons were represented by non-Hispanic Black persons. Having a family member imprisoned or incarcerated does count as an adverse childhood event or an ACE, which is associated with increased risk of adverse health events such as opioid misuse. Females and racial and ethnic minority groups are 4 times more likely to experience 4 or more ACEs, which indicates that they are at significant risk for these health effects. OUD also affects multiple generations. Neonatal abstinence syndrome may result from opioid use or management of OUD. And Robeson County has over 753 sustained CPS cases to this date. And that also counts as an adverse childhood event to be separated from one's family, which increases the likelihood of adolescent drug use.
So now to talk more about the opioid crisis in North Carolina specifically. Over 11 North Carolinians die every day from opioid overdose, and these deaths are not distributed equally. As you can see on the bottom line of the graph, in the past few years, we've seen an alarming increase in deaths due to opioid overdose, but in certain counties, such as Robeson County, shown on the top line of the graph, these rates are even more dramatic. Robeson County, for this reason, was chosen by Acadia for its very first mobile clinic treating opioid use disorder. And we want to take that vision and expand on it. So for this reason, we looked at other counties facing similar looking graphs and chose to continue to build on the program in Robeson County, but also include Richmond, Pamlico, Randolph, and Swain counties. In addition to geographic disparities in the distribution of opioid overdose deaths, there are also racial disparities. In historically marginalized groups in North Carolina, we've seen over 100% increase in opioid overdose deaths between 2019 and 2021. We wanted to ensure that we were addressing these disparities as well. So when we were deciding where we would distribute our mobile clinics, we took this into consideration. As you can see in our graph, these are the plans of where we would put our first 10 mobile clinics in year 1. And we chose this based on discrepancies in overdose rates between counties, as well as weighing their population. And we also put an estimate of where these might go in year 2, but the beauty of a mobile clinic is that you can really move it around to accommodate the ever-changing climate of North Carolina's opioid crisis.
All right, to reiterate what Molly has just said, we are expanding from the single addiction mobile clinic in Robeson County into 4 other additional counties for a total of 5 counties. And the current addiction mobile clinic, its services only include medication-assisted treatments and resources such as access to social workers, clinicians, therapists. However, we want to incorporate syringe exchange programs on board. These programs are going to help people who are struggling with opioid use disorder have access to clean needles to stop the spread of other blood-borne diseases. This will also give them a space to use while under supervision. So this is going to help medical professionals intervene if something is going wrong. And more importantly, this is going to create a pipeline for Acadia Healthcare, because by offering this harm reduction service, it's actually been found that people are 5 times more likely to want to enter a drug treatment program, such as those offered by Acadia Healthcare.
Okay, now I'm going to walk through the numbers a little bit. We're going to start by quantifying the cost to society of the opioid crisis. And then we're going to move on to the cost of the program, and then finally revenues from the program. So when talking about the cost to society of the opioid crisis, there's a lot of different ways to slice this thing. And looking through the data coming, for this presentation, it was pretty overwhelming how many different reports there were looking at it through different lenses. So in this one report, it talked about the cost of the emergency department visits due to opioid overdoses. It came up to about 15,000 emergency department visits in North Carolina alone annually, resulting in about 11,000 admissions, including 3,000 ICU organ failure, right? So that comes up to about $125 million cost for those hospitalizations. And when you consider the fact that about 77% of those costs end up being paid by the public sector, you're looking at about $96 million incurred by the North Carolina public. Now, broadening the scope a little bit, moving away from just emergency department and moving out towards just healthcare cost combined with criminal justice cost. This report found that when you look at the cost to society of treated versus untreated patients, you're looking at a cost savings per lifetime, per patient lifetime, anywhere from $25,000 to $105,000, depending on the treatment that was administered. Now, this makes, coming from a manufacturing world, which is my background, this makes a lot of sense to me, right? Toyota has been showing the world of manufacturing for 7 decades that when you start shifting your focus from fixing problems as they come up to more predictive and preventive maintenance, you save a lot of money in the long run with those hidden costs of breakdowns and such. So, you know, this is the healthcare equivalency, right? Value-based care is the healthcare equivalency. The doctors are the healthcare providers, doctors and nurses. They are the maintenance, and our bodies are the machines. And so we're talking about shifting from that reactive maintenance more towards that predictive and preventive maintenance. Now, the most recent report I saw, issued by the White House, found that previous reports had grossly underestimated the cost of the opioid epidemic to society. And when you zoom out and you really look and you take all costs into consideration, the total cost on society is actually closer to $504 billion. Now, if you assume that North Carolina's portion of that is proportional to their overdose-related deaths, then it comes out to about $20 billion in North Carolina alone in 1 year. That's about 2.7% of North Carolina's GDP. That's a massive economic cost. So now I'm going to go into the cost of our proposed program as well as revenue streams for our program. But before I do that, I do want to talk a little bit to answer a question that many of you may have, which is, why are we proposing mobile delivery units for this healthcare system? And there's a couple of reasons. Number one, it's the right thing to do. Because as Molly said, by having the mobile clinics, you can analyze the data, you can distribute those clinics where they need to be, when they need to be there, and it can be a flowing, agile system. So number one, it's the right thing to do because we're talking about shifting and delivering predictive and preventive maintenance, going back to my manufacturing analogy, to a population who has historically had to wait until catastrophic failure to be fixed, right? So it's the right thing to do for the people, it's the right thing to do for society, but it's also the right thing to do for Acadia Health. And here's why. There's been a long-standing trend in healthcare shifting that for a desire, a demand, shifting away from inpatient care and towards outpatient care, such as telehealth and home care, things of this nature. And the COVID pandemic took that long-standing trend and had a massive shock to that demand curve and pushed it out. So it's even more. And so while this particular program is aimed at, addressing the opioid use crisis, hopefully that abates over time. But this demand for flexible and agile care is not going anywhere. It's only increasing. So the lessons learned through the iterative process of mastering this delivery of agile and flexible care that Acadia will have through this program will position them to be more competitive in the future landscape of healthcare. And being a leader in a growing market is where any business wants to be. So now moving on to the cost of the program, we estimated that each mobile unit would cost about just under $500,000. Most of that you can see is a labor cost. Additionally, we'd have about $30,000 of vehicle costs, including maintenance, cleaning, things like that. And then our harm reduction would be about $54,000, and that includes Narcan, treating overdose, right? Vaccinations, tests for for viruses, things of that nature. So we're talking about a pretty wide scope of predictive and preventive maintenance. Now, we were trying to quantify, what's the payback for these types of programs for society? And when we make, there's a lot of different information out there. We made some simplifying assumptions. And with that, we came up with about the impact of this program on the cost to society would be about $577 million annually. Or put another way, about 3% of that total $20 billion that North Carolina Public incurs every year from the opioid crisis. Now, why is it important to quantify that? Well, Governor Roy Cooper and the government of North Carolina just recently put out that they're looking to increase their spending to address the behavioral health crisis. And when you look at their plan, a lot of these things are things that our program would directly impact. Right, we're trying to address the intersection of behavioral health and justice systems. We're trying to build a stronger statewide behavioral health crisis system, right? So it's only fair that part of the revenue stream comes from that money. So combining that with the anticipated reimbursements, we're anticipating that each van will generate about $1.6 million in annual revenue. Across 20 vans, that's $32 million a year, or Acadia's share would be $25.7 million annually.
So I know I spent a lot of time characterizing OUD, but we believe that this proposal best aligns with Acadia's mission of leading care with light. Because this proposal focuses on harm reduction, we will be destigmatizing OUD as well as other substance use disorders. By partnering with the UNC School of Medicine, Acadia Healthcare will be able to usher in generations of physicians and physician scientists who are destigmatized, will be more comfortable working with these marginalized populations, and hopefully be a friendly face for communities who have long since had unique traumatic experiences with the healthcare system. This will be Acadia's time to rewrite that relationship by delivering care directly to these populations in need and essentially be the friendly neighborhood healthcare team.
To summarize our business proposal, we are recommending that Acadia Healthcare partners with the UNC School of Medicine to expand their mobile clinics, incorporate syringe exchange programs, and create this harm reduction pipeline to increase their revenue and, more importantly, reduce the overdose rates in North Carolina. Thank you very much.
Good afternoon. Thank you for inviting us to present here in this conference, and thank you for staying the whole time and hearing us out. We are excited to present a financially secure and community-focused proposal for Acadia's expansion into North Carolina. However, first, I'd like to introduce myself and my incredible team here. My name is Michael Jensen, and I am an MHA student. This is Lauren Sattel. She is a DPT student. And this is Emily Ha, Emma Taylor, and Huey Bowie. And they're also MHA students. During our proposal, we'll first identify the target market. We'll discuss the implications of a competitive landscape, present economic projections, share an exciting and strategic social initiative, and then conclude with an overview of our risks and recommendations. Acadia Healthcare has tasked us to find a scalable expansion strategy that simultaneously establishes Acadia as an innovative leader in the behavioral health and addiction recovery space, achieves an annual revenue target of $120 million by 2028, better serves underrepresented populations, and increases community benefit. We recommend that Acadia choose option 1, building new facilities to expand its services into North Carolina. Specifically, we recommend that they build 2 inpatient hospitals, 2 CTCs, and create and operate a social initiative program called Carolina Compass, which includes both community outreach and mobile clinics. My colleagues, Emily and Emma, will go into greater detail about this program later. We aim to prove that this option is the best option that satisfies all given objectives and aligns with Acadia's mission, vision, and values. Through our own analysis and research, we have identified some shortcomings in the other options that will hinder them from either achieving their annual revenue target or providing world-class care and increasing access to that care in communities that experience disparities. Now, my colleague Lauren will walk us through the current market landscape.
Thank you, Michael. First, I would like to speak about social determinants of health in North Carolina. As we all know, social determinants of health massively impact mental health disparities across our state. First, rural residents are more likely to be in poverty and to be unemployed compared to urban residents. One such study found that those who are on long-term unemployment are up to 2 times as likely to experience mental health distress and mental health symptoms compared to those who are not. Secondarily, social determinants of health can be thought of as a ladder, with everything building on top of each other until it creates this unstable surface that can crumble and fall. This includes unemployment, poverty, the built environment, financial stress and strain, as well as stigma, which my colleagues Emma and Emily will speak on later. Lastly, one such example of social determinants of health is very clearly seen in Richardson County, which used to be one of the top manufacturing counties in North Carolina. However, over the past 30 years, as manufacturing has left North Carolina in droves, with approximately 50% of manufacturing jobs leaving over the past 30 years, and particularly since the 2008 recession, residents of this county are now forced to drive past closed factories day in and day out, where generations of their family could have worked overtime. This creates and fosters thoughts of hopelessness and despair within the community, which contributes to increased rates of suicidal ideation and other mental health distress symptoms such as depression and anxiety. Moving on, and for these reasons, Acadia will be moving into a robust target market in North Carolina. 44.7% of North Carolina adults reported symptoms of depression and anxiety in February of 2021, with approximately half of those adults being unable to access the therapy and care that they needed. This is incredibly important and speaks to the importance of Acadia entering into this space where they are truly needed to serve our most vulnerable communities. Additionally, opiate use disorder has increased in North Carolina across time, particularly following the trends of the United States, with a 75% of deaths from drugs now coming from opiates as of 2021. Lastly, the youth and adolescents in North Carolina are massively underserved. North Carolina ranks among the worst of the worst for this, number 42 out of 50 for high rates of mental health distress and low rates of access for youth and adolescents. I would now like to pass the mic on to my colleague Huey, who will speak on the competitive landscape.
Thank you, Lauren. At first, I'd like to address one of Acadia's major competitor being Monarch. Established in 1958 with an area focus in intellectual and developmental disabilities, mental illness, and substance use disorders. To my left is the map of where Acadia coverage in the counties within the state. One of the most recent initiatives being the mobile integrated care clinic provided in the counties above. With that being said, we recommend Acadia Healthcare to expand their facilities in 4 counties: Richmond County, Craven County, Davidson County, and Pamlico County. These 4 counties have suffered some of the highest rates of overdose deaths. For example, in Richmond County, we had a rate being the highest of the 4 with a rate of 85 deaths per 100,000, while Craven County being at the lowest of the 4 counties still had a higher rate of 64 deaths per 100,000. In comparison to the state average, Richmond County being at the highest of the 4 we're currently looking at a 118% higher than the state average, which is at 39. While on the other hand, Craven County at 64, being lowest at the 4, still being at 64% higher than the state's average. With that being said, we really would like to focus our efforts addressing these issues primarily in rural areas. Just as Michael mentioned, we'd like to put 2 inpatient facilities, one in Rockingham, North Carolina, one in New Bern. Opioid use disorder isn't the only issue that exists in these areas. Mental health issues are also becoming an issue in these counties. Suicidal ideation, as of 2021, the County of Richmond had a high rate of 60 ED visits for suicidal ideation per 10,000 rather than 100,000. While in New Bern or in Craven County, we're looking at 37 ED visits for the same issue. With that being said, we really would like to put our inpatient facilities in these counties to address these issues at the acute level. And from our inpatient facilities, patients will also have access to our outpatient or CTCs located strategically nearby. In terms of the market for CTCs, we would like to put one in Thomasville, North Carolina, where it would be close, being 1 county away from Richmond County, where a new inpatient facility would be. While we also acknowledge the small population of the town of Bayboro, we see it as an essential part of the county, being the largest town of the county, yet they're still facing lack of access to any facilities available. With that being said, the town of Bayboro, being in Pamlico County, is also really close, being next to Craven County, where our new inpatient hospital facility would be. Therefore, with these structures being built, we do see a benefit of having our patients coming through from an inpatient facility, transition into an outpatient care setting, and to have the right support to reintegrate into the community. And with that, I'd like to introduce my colleague, Michael, to go over economic projections.
Thanks, Huey. The de novo construction option provides great investment flexibility. What does that mean? It means that this strategy enables Acadia to both invest in revenue-generating treatment facilities and social outreach programs to adequately address the health disparities experienced across the state. Excuse me. So with this moving forward with this option, we propose the following breakdown of the $180 million investment. $120 million allocated to build the 2 inpatient hospitals, $40 million allocated to build the 2 CTCs, leaving $20 million to create and operate Carolina Compass to address those health inequities, especially in our rural populations. Assuming that the construction timeline and the effectiveness of Carolina Compass goes to plan, Acadia can expect to supersede its annual revenue target of $120 million in year 3. That accelerated volume of sales comes from 1, greater market penetration, as well as expansion in both Medicaid and Medicare Parts A and B within the following year. Incredibly, even though we propose that Acadia set aside $20 million to operate a philanthropic social program, this strategy still attains the highest levels of revenue for their company. And now Emily will introduce Carolina Compass.
Thanks, Michael. So a key consideration for our strategy was also health equity. And that is why we propose that Acadia creates a social initiative program called Carolina Compass that drives the path to healing by breaking the stigma and increasing access to behavioral health services. The biggest killer out there isn't opioid addiction. It's actually the stigma that comes with substance use disorder. In a recent study that was done by Indiana University on addiction stigma, they found that 3 in 4 respondents find those who use substances untrustworthy. That 3 in 4 respondents do not believe that those who struggle with substance use disorder have a chronic mental illness. That half of respondents find that medication for opioid use is just substituting out one drug for another. And that half of respondents do not want a treatment facility in their neighborhood. Stigma keeps people in the shadows, and stigma keeps people from asking for help. Nearly 90% of those who are struggling with opioid addiction are not in treatment. And this is a surprising and alarming statistic. That is why we propose that Acadia builds these inpatient hospitals and CTCs in the most vulnerable parts of North Carolina to provide treatment and services to those who most need it. Meet Jacob Harding. Part of a core group of friends that grew up together in Greenville, North Carolina, Jacob and his friends struggled with substance use disorder at a very young age. And by the age of 24, he attended 10 of his friends' funerals, most of whom passed away from opioid addiction. With a combination of luck, determination, and an excellent treatment facility similar to Acadia's, Jacob was able to overcome his opioid addiction and was given a fighting chance at life.
Now he's 29 years old and a medical student at Eastern Carolina University, where he's working hard to break the stigma surrounding substance use disorder in North Carolina. A story like Jacob's is very powerful because it shows that services and treatments that Acadia's facilities provides helps people like Jacob overcome their substance use disorder. And why is this important? Because earlier this year, Acadia opened a CTC in Linwood, Washington, and the community banded together to protest the opening of this CTC because they feared the types of individuals that would be coming to their community to receive treatment at this facility. But if they heard powerful testimonials similar to Jacob's, there would be widespread community acceptance, and people would be more likely to come out of the shadows and seek out the treatment that they need at Acadia's new inpatient hospitals and CTCs. So that leads me to my first phase of Carolina Compass, which is community outreach, aimed towards breaking the stigma. We encourage Acadia to build and establish key relationships with key leaders and members of the community, and also get involved in local community events and activities, such as attending town hall meetings, sponsoring community events, and also supporting local businesses. Furthermore, we encourage Acadia to address the concerns of the community prior to the opening of these CTCs and inpatient hospitals so that people understand that the services that Acadia provides is of benefit to their community rather than a threat. Secondly, we encourage Acadia to invest in a more expansive PR and marketing campaign in which Acadia shares powerful testimonials of successful patients who have gone through and got treatment in order to overcome their substance use disorder. Furthermore, creating educational workshops can help increase health literacy, especially within the rural communities of North Carolina who are unfamiliar with behavioral health and what behavioral health services are. And then lastly, we encourage Acadia to partner up with Shatterproof, a national nonprofit that is dedicated towards reversing the stigma surrounding the addiction crisis in the United States. They're very active in the political space and also create fun and engaging events that inform the communities throughout the United States on addiction and substance use disorder and breaking the stigma. Shatterproof just recently created an online platform called Shatterproof Atlas that matches those who are struggling with substance use disorder to the right treatment facility that best fits their needs. And given that we are encouraging Acadia to build these new inpatient hospitals and CTCs, Shatterproof would help put these new facilities on the map. Overall, community outreach is important because it helps break the stigma so that people can come out of the shadows, get the treatment and the services that they need. Now I'm going to pass things along to my colleague Emma, who's going to talk about phase 2 of Carolina Compass.
Thank you, Emily. As we know, today's healthcare landscape is constantly evolving. Therefore, it is imperative that we address the gap in accessibility for our rural North Carolinians. This mobile initiative is an approach designed to enhance access to opioid use disorder treatment, namely through medication-assisted treatment. In addition to offering MAT aboard the buses, we recommend counseling services are also offered for those who may need it. To maximize the impact of this initiative, we believe obtaining 4 units and placing 1 at each of the new facilities my colleagues described is the best approach. The initial outfitting cost of these units comes to $1.6 million and includes expenses such as technology, equipment, and infrastructure. Additionally, the annual operating cost comes to $1.1 million and includes costs such as staffing, maintenance, and fuel. This holistic approach ensures that individuals not only receive the medical treatment they need, but the emotional and psychological support they want throughout their recovery journey. You may be asking yourself why we did not move forward with a telehealth option. We found that 37% of North Carolinians do not have access to stable and reliable internet connection. The mobile units partnered with the community outreach will best reach individuals and improve access in North Carolina. These mobile units will also increase referrals and revenue for Acadia as they can reach individuals who would otherwise not receive treatment at a fixed Acadia site. These mobile units promise to improve not only accessibility, but affordability and retention. Now, I'd like to discuss the timeline for Carolina Compass. In Q1 of 2024, the planning and design for the mobile units and the community outreach program will begin. In Q2 of 2024, the community outreach programs will go live in the communities. In the latter half of 2024, the outfitting process will begin for the mobile units. Then, in the first quarter of 2025, the mobile units at the CTCs will be operational. And finally, in the first quarter of 2026, the mobile units at the inpatient hospitals will be operational. Now, I'd like to discuss some of the risks we've identified and how we believe Acadia can mitigate those. We acknowledge that there is substantial financial risk when building new facilities, as it is the most expensive option. Additionally, we've identified 4 other major risks Acadia may face when building new facilities, and this includes low patient volumes, stigma in rural areas, competitive landscape, and staffing shortages. However, we are confident that the following developments will significantly mitigate those risks for Acadia. Later this year in December, Medicare and Medicaid plan to expand coverage for North Carolinians, which will allow Acadia to expand the number of compensated services it can provide. Additionally, the Carolina Compass marketing campaign will successfully combat stigma through the community-focused educational initiative and community partnerships. Finally, the strategic location of the Acadia facilities is a key advantage for Acadia. You can tap into the populations in these rural areas with minimal competitor presence. Additionally, the close proximity to the existing Acadia facilities will enable you to leverage the existing workforce when recruiting and training new staff. I would now like to pass it off to Michael for some closing remarks.
Thanks, Emma, and thank you, team. We officially recommend that Acadia choose the de novo construction of 2 hospitals, 2 CTCs, and the operation of Carolina Compass to expand its services here in North Carolina. This strategy is both financially viable and equitable in both the way it increases market share for Acadia, as well as increases accessibility to life-saving treatments for our rural friends. There are many Jacobs out there who are seeking an affordable and successful path to recovery. With our proposal, Acadia Healthcare is optimally situated to lead care with light in our North Carolina. Thank you.
We just want to thank all the teams for participating in the competition. This was the largest case competition we've ever had, and we started with 27 teams and 130 students competing, which is crazy but wonderful. We're really proud of all our teams and everybody that competed, and I know this was probably hard for y'all to come back again and present for the 3rd time, but we appreciate the time. We also thank all the judges, which several of you are here today, including David Keys, who's with Acadia, and he will announce the winners. And so I would just like to say the 3 teams, if all 3 of you could come up after the announcement so we can take some pictures, and then everybody is welcome to head over to Keenan Center Dining Room for a quick reception. Thank you.
Thanks, Karen. Can I just get another round of applause for everybody, not just the groups that presented. You know, when Aaron said that there were 27 teams, I thought, my goodness, how on earth are we going to judge across all of those? You know, it did get cut down to 17. We still had a near impossible task because truly everyone did a phenomenal job on this case. And judging between them is really hard. It comes down to just minute issues. Truly, I mean, you can see from the 3 that presented today what a tough job it was. Also, I was talking to Karen Cochran earlier today, and we were talking about case studies in general. All of you are winners just for participating in these. For those who weren't involved in the case study, I don't know if you understand like how hard this was. They basically had 2 weeks to go through a case packet they were given, while some of them were having fall break. Some of them were exams, because remember, this is cross functions, different areas of the school. So people had to come together, practice this, come together with, all the information in that 2-week period. So it was incredibly hard. And I mean, truly, they did a tremendous job. When I think about our strategy meetings at Acadia and the things that we evaluate, every one of these groups really went deep in the same types of things that we consider. So again, I thank you all. We do have to determine winners here. And I will say, anyone who sat in my panel earlier knows that I'm a free markets, pure capitalist. Incentives do matter. So I love the fact that there are dollars tied to this, because that provides the incentive for everybody to give up on their breaks and, work very diligently over 2 weeks. So there are prizes associated with this. Again, very, very hard. We really had to deliberate on who the winners were here. And so I'm going to start with number 3, the third group, 24, team 24. Excellent. Yep. Oh, yeah, I should say $2,500 to team 24. Okay, between the first 2 teams, again, incredibly hard. I wish we could have a tie here, but we can't. We have to choose one. So I'm going to announce the winners overall. Team 20. So, and that's a $10,000 prize for team 20. And as you guys may guess, that leaves team 16 with a $5,000 prize. 15, 16. No. Thank you again. Great job, everyone.